One of my favorite neuroscience educators, Dr. Lori Desautels, coined a phrase in my life when I first met her, and she said, "Betsy, you have to go slow to go fast." So like, I'm the kind of person where I want everyone to understand this. I want everyone to get that this is the missing link. I want it to impact everyone's lives, and I want it now. But I know that change takes time, so patience is really important. We've got an opportunity here to increase knowledge of our own neuroanatomy, of the science behind trauma, of the science of our brains and the power of our brains. And so having that message, being patient with that message, understanding that, there's a lot of stigma surrounding mental health. People who have dysfunction in their home don't want to talk about it all the time. And that's just not them, that's us. That's all of us. The original ACEs studies were done with 17,000 middle-class people. And so as educators, as community members, as stakeholders, as people who are helpers, as parents, family members, we all have to understand the impact of ACEs and be willing to admit to ourselves, yeah, that happened in my life. Okay, I can see its impact now. It's happening in your life. I see the impact of that. And so if we practice patience as we're spreading this message, because people don't always want to get it right away, and they don't want to admit it right away, and they don't want to see the impact right away. I mean, who wants to say, I'm an adult, I'm parenting someone, my trauma from my childhood is impacting my child? Whoever wants to have that? But until we do that with patience, we're never going to get to the next step, which is love. Right? And that's what we're trying to increase, is love. Love for ourselves, love for each other, love for the community. And so we've got the opportunity, we've got to go slow to go fast and be patient about it. And that's the message that I always want to give to community members. We're not going to convince everybody right away. We're not going to get them to admit, we're not going to get them to practice the things that help mitigate. We're not going to build these systems in our community overnight. It takes buy-in. And so that patience piece, I think, is really important so that we can create this culture of love. So about, more of that generational stuff and more of that trickle down, how do ACEs impact the next generation? I could tell you countless examples of students whose parents are struggling. They aren't living with their parents in other cases. I've worked with kids who have had a parent die, they have a parent in jail, right? They might have step-parents who are distant or out of the picture. And so they suffer those losses over and over and over again. And so I've directly witnessed students repeating their parents' mistakes. Self-medicating, right? Whether it's on nicotine or THC or other drugs. Saying, I'm just gonna drop out, I'm never gonna graduate. I can't do it. I black out from anger because that's what they've witnessed. But then I'll get back to that other point and the bright spot, because it's really important for us to understand and remember that ACEs are not the final predictor. I've also seen the opposite, right? Where the toughest students that I saw in elementary school, because they had a protective factor, were then working really hard with their kids not to repeat those same mistakes. Not perfect, right? But still working really hard not to repeat those same mistakes.
Certainly throughout the years that I've been working as the Chief Deputy Prosecutor of Jefferson County and now as judge, I think ACEs plays a role in just about everything that I see and have seen on a day-to-day basis. In court, we have children who are acting out and engaging in delinquent behaviors as a result of something that's happened to them at home or something that is going on at home. I see adults in criminal court who are engaging in criminal behavior that are driven at least in part or in some way by adverse childhood experiences. And the challenge is really understanding this and appreciating what role ACEs are playing in each case and trying to make the best decision that you can in each case, being aware of the role that ACEs play. but it's not an easy task. It's clear from the literature, from the science, that ACEs can have a significant impact on a person's life. And certainly the more that we recognize this idea in our community, the better I think our community will be in terms of where we are in crime. One of our biggest challenges in our community continues to be illegal drugs, methamphetamine, misuse of Suboxone, fentanyl. And we certainly see that people with higher ACEs scores or ACE scores are more likely to report addiction in their lives. So giving our community more opportunities, I think, for treatment would go a long way in curbing a lot of what we're seeing in criminal court and delinquency court. And I know there's some discussion about, possibly setting up regional type facilities at the state level to address mental health and to address addiction. I guess the short answer is the ACEs are playing a role in the crime that we're seeing on our streets, and to the extent of it may or may not be clear, but they're playing a role and we've got to be aware of that. In child in need of services cases that I hear those every Thursday, and in those cases I see a lot of children who are born drug exposed. So kids are born in the hospital and they're born with methamphetamine in their system, or at a high level of Suboxone or marijuana even. And so I'm seeing a lot of that. And I'm seeing a lot of parents who are addicted to these drugs, no question. I also see a lot of truancy cases on the delinquency side, or juvenile status offenses. Most often the driving force behind that is the home environment. Most often it's parents who are either lack resources or struggling themselves with mental health issues, or the child is struggling with mental health issues that have either not been identified or not been addressed correctly. So those are probably the big ones that I see most often. I'm a referee, so when I'm in court, my job is to listen to all sides of a particular issue and receive whatever information that I can from everyone in the courtroom and try to make the best decision that I can based on that information. And for example, we have a probation department a juvenile probation department that is responsible for implementing services to children who find themselves in the delinquency court. And they offer a wide variety of resources, and I'm able to order those resources put in place. On the CHIN side, or the Child in Need of Services side, we have the local office, the Department of Child Services, and they have, again, a wide variety of resources available to them. And I also have to share that we have a very robust CASA program, the court-appointed special advocates in our community. We have a very strong program, and that is an agency where we have volunteers who graciously volunteer their time and efforts and come into court, and their job is to look out for the best interest of a child in court. And they're able to work with the Department of Child Services, work with probation, or work with the court system and the parents to look out for the best interest of the child. So the upshot is that I'm in a unique position of being able to order these services be put in place and ensure that these services are being implemented.
From an employer perspective, we see more substance abuse related issues. Of course, those things come with the drug testing, randomized and otherwise, screenings, increased healthcare costs for employees, smoking, for example, driving up costs. The emotional stability, for example, employees bringing emotional issues into the workplace and small issues becoming big issues because of lack of preparation on their part or poor emotional stability brought into the workplace from outside. Every employer I know is not only interested in gaining employees, they're interested in gaining employees that are going to be responsible, they're going to be, co-workers you would want to work alongside, have, come to work on time, be reliable, And that is definitely one of those impact areas, because it seems like there are fewer and fewer of those that to go around to all the employers. So any employer thinking of coming to an area, one of their first challenges is finding those employees that are the type of talent they're looking for. When my former employer, Madison Precision, added an expansion, this has been probably more than a decade ago, I was interviewed by Indiana Business Weekly, and the big question for me is, how are we going to manage our expansion and get employees? So, you know, that's going to be a question for any organization moving in, is how you're going to get those good employees that you want to get. And there's the generational aspect, where so many employees, you know, you look at the younger employees, but the parents, the 30-something, 40-something, 50-something, they're in that cycle too, where they have some of those same issues, and it's passed on from one generation to the next, and it adds to the challenge.
So obviously our youth are our future workforce, and the long-term impacts of ACEs include, for example, lower educational attainment, poorer health behaviors and therefore health outcomes, and struggles with mental health concerns, particularly depression and anxiety, and then substance use disorder. Well, all of those things also affect the quality of the labor force, right? So educational attainment obviously is important to economic development. We need workforce that's well trained at all levels of education for different sectors of our economy, but a low educational attainment will limit development. Because you need a managerial class, you need small business owners, you need folks who've got good knowledge to build businesses that also employ people who are trained in the trades, right? So that educational attainment is a core piece that's important to economic development, but also how people show up at work. The stability of a worker is shaped by their health, their mental health, and their substance use, for sure. And so when people are struggling with those issues, they're a much less reliable worker. And so part of promoting a stable, high-quality workforce across sectors and levels of training and education is making sure people are healthy and able to have stable, healthful lives. And so I think this ends up becoming very important to employers. In our region, we have real challenges around substance use disorder. And those challenges are rooted in adverse childhood experiences for many of our community members. And so when we take seriously the need to address this as a community, we can reduce that problem, and that will improve the stability of our labor force.
Here it usually comes up when I ask a parent how things are going. I usually like to start with that sort of question and just ask them how things are going, because oftentimes that gives them an opening to say, oh, well, this is going really great, but these other parts of parenting are difficult. And often I will ask them to sort of parallel that to their own childhood and what they expected parenting to be like. And then I realize that there are lots of small things that could be broken down into the parenting conundrum of what it is. So we see that children might have issues with schooling. They may have issues with their social interactions with their peers. Maybe they're having difficulty with understanding what their teachers are saying or expecting of them. Or perhaps we have a mother who's having trouble with her own mental health, or a father who's dealing with the stress of being able to maintain a job while also providing emotionally for his family. And then we see how that might affect them, because now you're trying to pour from what we call an empty cup, right? So we're having difficulties with our own emotional regulation and our own coping skills, and that makes it difficult for you to, at the end of the day, have those emotional reserves or those physical or stamina reserves to be able to help a child with homework, or give them a nutrient-dense meal for dinner, or even read to them in the evenings. So I think that when we talk about what I see in the office, a lot of it is just parents asking for help on parenting and what that is and what it should be and what it could be and what might help them be better parents for their children. I think when we talk about understanding what ACEs is and what that really means for a community, we have to sort of understand what it means to be trauma-informed, right? So when we're trauma-informed, we understand that trauma happens, and we understand how widespread it can be and the impact of that and what that can mean for every aspect of someone's life. But we also take that understanding and we say, okay, now we understand that, so what can we do about it? What sort of things can we do as community members to make sure that we have policies and practices in place to help with those and to allow for some healing to go on without placing blame or re-traumatizing anyone?
So I think we see the biggest difference in a child's brain development, where it really starts to impact them the most. When a child goes through a trauma, the brain releases cortisol and adrenaline, which increases our heart rate. It increases our blood pressure, all the things that are normal parts of the sympathetic system that are there for fight or flight. We need it. If there's a bear in the hallway, we want that to turn on. The problem is for kids that are in these situations and that doesn't turn off. They have ongoing traumas and it just never gets the chance for that brain to shut down to the rest and digest stage where they can kind of heal and reset from it. It stays there. And then over time, all of that starts to just wear and tear on the brain. And we start to see it having breakdown in areas. And then you start to see the children having more issues with impulsiveness. They start to have higher rates of decision-making problems, of just not being able to work through things, see the consequences. And then we see an increased rate in mental health disorders, anxiety, depression, impulsiveness. And then of course you see the physical impact of that too, of the wear and tear on the medical issues of the body and the physical sensations too. So I think the biggest impact that I would see is obviously just the mental health part that comes in, and whatever they're struggling with. So you're seeing acting out behaviors. Oftentimes it's teachers or parents just saying that the kid's acting out, they're not listening. And so sometimes you even just see them getting put on medications that are not appropriate because they think they're just impulsive, and it's like, well, was there trauma, right? I think it's, for me, that's what I'm always looking at, for that trauma lens of, is there something else that maybe accounts for it? So if a kid is acting out, it's not just because they're manipulative and they're acting out. They're trying to tell you something's wrong and they just don't have the words for it. So then we see behaviors. So I think that's where we see it a lot with kids, is you just start to see behavior problems and relationships break down. And then they don't know how to deal with it and manage it. And then for the adults that I see, you see that they've had that trauma and they've done it, and it leads to those health issues that they're coming in with, or trouble sleeping, or they've had a major PTSD kind of diagnosis that they're coming in to try to deal with, and oftentimes even then substance use as a result of the traumas that they had too. Even if we don't see it, you're probably impacted by it some way, because there's just a toll. So if you're just seeing one side of it in a medical profession, you just see health issues. Well, why are there an increase in health issues? If we're seeing less kids graduating, why is that? And maybe people not coming to the community and building it the way that we want, right? We want to grow the community. You want it to be a happy, healthy place to live. Recognizing where are the barriers for that to kind of see that to fruition is important, because these things are the stuff that's impacting it. There's an undercurrent, right, of these things that are impacting the residents that are here. And so it's important for us to see it and know it and be able to address it and come up with solutions so that we have a healthier community as a whole.